Good afternoon, Victoria County. I would just like to remind you all that KView, Kicks, Magic 95 are also live on air right now, streaming this as well. For any local information regarding COVID-19, please visit victoriatxoem.org or call our hotline at 361-580-5796. As of 2:30 today, we have 5 new cases of COVID in Victoria County. That totals us at 32. 9 of these are suspected to be community transmission, 6 of them are recovered, and 26 are still active. Today we will have legal and law enforcement to answer any questions related to the city-county stay home, stay safe order, and they'll answer frequently asked questions beginning at our hotline, and then we'll have Dr. McNeil and David Gonzalez to discuss COVID-19 in Victoria County. Right now I'm going to turn it over to Thomas Gush, the city attorney, Chief Craig with the police department, and Chief Boyd with the sheriff's office. Thank you.
Good afternoon. My name is Thomas Gush. I'm the city attorney, for those of you who haven't met me, and it's my pleasure to advise the leaders who are making the decisions to protect our community. The questions I have to answer today include the following. First, how is the city and county order different than the governor's order? Under the city and county orders, non-essential workers are required to stay home. It's an enforceable order enforced with criminal penalties. And essential workers are allowed to go to work so long as their workplace enforces a mandatory 6-foot separation or provides adequate shielding and also provides necessary sanitation procedures. I've also been asked whether non-essential workers can continue to work as long as they work from home, and the answer to that is yes. The reason that our order does not close businesses is because we recognize some businesses can stay open with telework. But please be advised, you cannot take clients into your own home. That would be a violation of the order. Many people are wondering what is considered an essential business, and I recognize that's a complicated question. In order to answer the question, you have to start by looking at the CISA document, which is about 10 pages long. And then you have to add to that list the things that were added by the governor, which include religious services, parks, jogging, and some other things. And then you also have to look at the mayor's and judge's orders, which also added daycare facilities. And I want to announce that today that the mayor has also signed an amended order which adds even further. Libraries and hotels are now considered essential within the city of Victoria as well. If you'd like to get a copy of the amended order, you can go to the website victoriatxoem.org. People are also asking whether or not, if they are an essential worker and need to go to work, do they need to carry with them a letter or some other form of credentials in order to prove that they're essential workers? None of the orders currently in place require such letters. I know that many employees are receiving such letters from their workplace in order to provide in case they are ever asked, but they are not required under the current orders. Are there any businesses that we know are non-essential businesses? Can we simplify things? There were a few things that were listed in the governor's order that are clearly non-essential businesses, and they include cosmetology salons, gyms, massage establishments, tattoo studios, and piercing studios. If you're not on that very short list, I'm sorry, you have to go through the whole exercise to determine whether or not your business is essential or not. And finally, is there a way to get an exception so that my business can be considered essential? There is a process that's been set up by the governor's office. There is a website on the Texas Division of Emergency Management, TDEM's webpage, where a business can request to be added to that. And we recommend that businesses that are seeking to become declared essential businesses go through that process. I'll now turn it over to Chief of Police, J.J. Craig.
Thank you, Thomas. A couple of questions that we've been getting in the police department, and so I'm going to go through those with some answers. First one is, are we under a curfew? The answer is no. Our current order is seeking to control social distancing and contact amongst groups of people. A curfew would not help us in this situation. Can I take my family to the park? Yes, you can take your family to the park, but you must socially distance yourself from others by at least 6 feet. And please note that while park equipment is open for use, there is signage posted and it is not being sanitized. Can I go outside for a jog? Yes, but you must socially distance yourself from others by at least 6 feet. Can I go for a walk with a friend? Yes, but you must remain 6 feet apart. Are there roadblocks in the city limit? There are no roadblocks in the city limit. We are not restricting travel through the area. Are there issues with compliance? Yes, we have seen some issues in compliance. We have received complaints, and we are following up on those complaints, responding to those complaints, and taking appropriate action depending on a case-by-case basis, depending upon what is going on and what's present for the officers when they arrive on scene. And at this time, I'll turn it over to Chief Roy Boyd.
Thank you, Chief. The Victoria County Sheriff's Office has also received questions from individuals trying to seek guidance with regards to these orders, and I'll go through some of the more common ones. The first one is, can I go hunting and fishing? The answer is yes, as long as you maintain 6 feet between you and whoever you're going to enjoy this activity with. The next question that we're getting a lot of is, can I travel out of the county? The answer is yes. None of the orders restrict travel. Next question is, if I travel outside of the county, do I need to self-isolate upon return? The answer is, if you travel to a high-risk area within the state, we recommend isolation. However, according to our current orders, if you become symptomatic, are awaiting testing or results, or have tested positive for COVID-19, you and all members of your household are required to isolate. Another question is, can I have family over to my house? The answer is no. Our current order is a stay home, stay safe order. Everyone is required to stay home unless obtaining or providing essential services. Now the question is, are there roadblocks at the county line? And I've been receiving this one actually from other law enforcement in the evenings. The answer is no. There are no roadblocks at the county line. We're not restricting travel through the area. Are there issues with compliance? Just like the police department, yes, we are seeing some issues with compliance. We ask that people use common sense, that they take a look at the order, and that they comply, predominantly with the 6-foot spacing portion of the order, because this is one of the key components. We ask that people that are out in public areas as well as in other venues, please maintain your 6-foot spacing. And what about reporting violation of city-county order? If you see a violation, call the COVID-19 hotline at 361-580-5786. We have peace officers on hand to field any reports of violations Monday through Friday from 8 to 12 a.m. and then from 1 to 5 p.m. After hours calls inside the city limits, call the police department dispatch at 361-573-3221, or call, if they're out in the county, call the Victoria County Sheriff's Office, 361-574-8040. Now we'll take any questions that you may have.
Chief Boyd and Craig, could we just start, have any citations been issued or just been verbal warnings to violators?
To date, on the PD side, it's just been verbal warnings.
And it's been the same for us. What we're finding is once we point out the violation to people, they are complying readily.
Okay. And then I was was just wondering if we could talk about how each of your departments are enforcing the orders. Are you primarily responding to complaints and then investigating those? Are you proactively going out and looking at businesses? How does it work on your end?
Primarily responding to complaints and generating calls for service based on those complaints. We have changed our enforcement posture in such a way that officers may see a social gathering that violates the stay home, stay safe order, and they will stop on their own in terms of and take initiative to do that.
And we're doing the same. We've issued written guidance to our field personnel to ensure that we try to gain compliance of these orders.
Okay. And if you're able, could you characterize the violations we've seen so far? Are they primarily businesses that aren't doing correct practices? Are they groups of people socializing with people they don't live with? What does it look like right now?
In the city, it's a violation of the social distancing requirements.
From on the business end?
On the business end, it's still the social distancing perspective.
It's the same for us. What we're seeing is we're seeing people that want to get together at residences and try to get together and have barbecues and whatnot. We're trying to discourage people from that, this order does. And then also, just as the chief says, at businesses. Fortunately for us, a lot of the businesses are trying to take it upon themselves to enforce the 6-foot rule. We appreciate their cooperation. We just ask that everybody keep that in mind.
Okay. You had mentioned that employees themselves don't need letters to prove that they are essential workers. Do businesses need any type of proof that they are an essential business?
The question is whether or not a business needs to create a letter to prove that they are essential, and the answer is no. There are no requirements for certification letters.
Okay. And then going back to what you had said earlier, Thomas, about kind of thinking about whether a business has essential or non-essential workers, is that a better way to think about this than essential and non-essential businesses?
The question is whether we should think about this in terms of essential and non-essential workers instead of businesses, and I think the answer is yes. I think it's much easier to adapt your situation to these orders if you think about which workers are essential and which are not.
Okay. And we've gotten a lot of questions just from people who are having a hard time understanding why, say, a home improvement store might still be open today. Can they be open, and if they're open, should they just be, are they the ones who should be focusing on essential versus non-essential workers and not whether they themselves as a business?
Yeah, I'm not going to get into whether or not any one particular business is essential or is not essential, because obviously I'm unfamiliar with the line of work being conducted in every business in town. But each business should go out and look at that list at CISA, at the governor's order, and at the local orders, and determine for themselves whether they're essential or not.
Okay. And what would your advice be for employees who are confused about whether they themselves are essential or non-essential and aren't getting perhaps the guidance that they need from their employers who are telling them to come to work no matter what?
Certainly they need to work that out with their employers. Again, all of the documents that I've referenced are available online. The CISA document can be found at cisa.gov, and it's the guidance that was issued on March 28th.
Okay. And then for specific questions, if someone wants to know if they can keep their business open, can they call the COVID hotline to get an answer or not? Or is that better for them to make the self-determination?
We prefer for people to make a determination on
Okay.
their own. We tried to provide some assistance to that yesterday, but we've scaled down that staffing today. The order was issued by the governor, and he's the one who established the definition. And so we're having a hard time necessarily reading his mind and seeing what exactly he wanted. So it's really going to be up to individuals to make that determination on their own and then to contact the TDEM website to try to get further clarification.
Okay. So, I mean, would it be fair to say that the only businesses that we know for sure are non-essential are those that are specifically outlined by the governor, gyms, hairdressers, stuff like that? Like those are the only ones that are point blank definitely non-essential?
That's correct. The
Okay.
only clearly non-essential businesses are the ones that have been listed by the governor.
Okay. And then Chief Boyd and Chief Craig, just going forward in the future, do you anticipate still having the primary strategy being responding to complaints? Is that how you anticipate enforcing this moving forward?
Yes.
Okay. I think that would be all on my end, unless there's anything else that you think folks are particularly confused about that you haven't already touched on.
Are there any other questions then?
Yes, we have a listener that's asking for parents who have court-appointed orders for visitation, how does this apply when the child is between households?
The state Supreme Court has issued some guidance on that issue, and according to the Supreme Court, they are urging families to follow their court orders. A court order is still in effect and you should still follow it. However, I do recommend that if there are concerns, that individuals either contact their private attorney or look for that guidance on the Texas Supreme Court's website. Are there any other questions? If not, then I thank you for y'all's time today, and we're now going to turn this over to Dr. McNeil and David Gonzalez.
I just wanted to thank our law enforcement and legal counsel for giving you guys the update on those frequently asked questions. For those of you tuning in, as of 2:30 today, we have 5 new cases of COVID-19 for a total of 32. In just a minute, David will break those numbers down a little bit more for you. Right now we have Dr. McNeil, our local health authority, and David Gonzalez, the director of the Victoria County Public Health Department, to give an update on COVID-19. I'll turn it over to Dr. McNeil now.
Good afternoon, and thank you very much. Okay, so today I just really want to mention just a couple of things, and then I'll turn it over to David, and of course we'll be here for questions. The first thing, what I really want to talk about is the outbreak at Post-Acute Medical, and I'm sure that that's what people have a lot of questions about. I will tell you that this has been a trying situation and something that we're working very hard on. This is what epidemiology and health departments are designed to do, is to find outbreaks like this and to limit them. I can also tell you that working with Post-Acute Medical is working out very well. We seem to have a good relationship, and they are being very, very cooperative, and I'll tell you about that in just a little while. But for the most part, we have isolated. I understand there are 2 new cases that were out there, but I just had a nice conversation with their chief medical officer in New York, Dr. Adam Burek, and as of about 2 hours ago, as of about 1 to 2 hours ago, they had tested 9 more employees, and all those employees were negative. I will tell you this, the testing has been somewhat complicated. We are getting it done, though. We are getting it done. But the problem is that it is so hard to get the media and the testing equipment that we need to do it because, frankly, the United States just does not have enough equipment to test everyone that needs to be tested right now. So, with that in mind, we have gotten together with everyone we have. All of us have worked all morning on finding testing material. We've actually had people drive to other areas to bring testing material back for this. And I can tell you that we have come up with more tests, and we are aggressively testing those individuals there. I just found out 5 minutes before I came in here, I spoke with Misty, who's one of the regional directors for NextCare Twin Fountains. And she has come up with 41 more tests, and as we speak, they are going right now to the facility for on-site testing. Every patient there will be tested today. Excuse me. Every patient will be tested there today, and then they're going to test more employees. We have set up priorities for who's being tested first. Of course, anybody with any symptoms and those with direct exposure to anyone that has been tested positive with COVID. So we have a great plan. We're working it out well. We've done at least 9. I've also been told that there have been several other tests done in the private sector, and that is working out well. Post-Acute Medical has also instituted a lot of other safeties and precautions that they put into place, and I feel that it's important that everybody understands this and understands how hard we're all working together to get this situation remedied. They have taken the step, and I applaud them for this. I happen to be one of the doctors that believes that some of these experimental drugs might be good for the prevention of COVID. I've looked at some of the data. There are no specific tests, and I'm talking about hydroxychloroquine, the medication that's also known as Plaquenil. It has been shown in non-controlled studies to possibly help prevent this disease from being acquired. They have taken the step to offer that to every employee out there. And I think that's remarkable. I applaud that. They are offering this medication at no cost to all their employees, and I think that most of them are going to take it. There are some certain screening things that have to be done. You can't have any kidney disease, you can't have liver disease, but that's just the nuts and bolts of giving that medication. So I applaud them for that. I think it's a good idea, and I think it's something in the future that we're going to find once the studies have bared out that this is a safe drug. I can tell you that some of the most respected physicians that I know are taking the medication themselves. So that is something that's on the forefront of medicine, and I applaud them for doing that. They're offering that to their employees. The other things I want to tell you is that everybody in that facility is wearing a mask. That is something that we discussed, and that's something that they were doing even before this, so they continue to do that. They have suspended treatment in their outpatient wound care and physical therapy, and basically they have taken the facility to where only essential people are entering. And that's what we do when we find an outbreak like this. So this is really a testament to the whole community pulling together. We have the private sector, we have the state working hard to supply us with tests. They're getting tests down here because they know we need them. We have the private sector trying to go elsewhere and get these tests. We have private clinics other than, I know that Detour on Demand has tested some of their patients as well. So we have really pulled together as a community, and I can tell you as a public health physician, which is what I am now, I can tell you for sure that this is very impressive, and our health department has done a wonderful job as well. So our epidemiology team is working, and I do mean literally day and night, on this and all the other issues. And I think it's working, folks. I think that overall, when we look at the numbers, I'm hopeful that I expect there will be more cases, don't get me wrong, but I'm hopeful that maybe we can slow this down and try and get our lives back to what we want them to be. So the one final thing that I want to say, and this is something that I'm not real sure this is very newsworthy, but I think it's something that really points out something that shows the cooperation between us and post-acute medical. The owner of post-acute medical has spoken to Dr. Adam Burek, who's the person that I've spoken to multiple times every day since this began. They have agreed to donate 30,000 surgical masks to our local effort. And these masks will be delivered to our emergency management department, and we will have 30,000 surgical masks that we can use for our healthcare providers in this area to help stem the spread of this disease. They didn't have to do that. I don't think they even wanted me to say anything about it, but I think that it's a wonderful thing that they've done, and I think that it goes to show the cooperation that everybody is doing to try and slow the spread of this disease in our community. So that's really it. I'll be around for questions. I'd like to pass it to David, and he'll start telling you the real stuff.
Yeah.
Okay.
Great. Thank you, Dr. McNeil. And just to add on some of the things that Dr. McNeil discussed regarding post-acute North, and just kind of want to get a little bit, offer some clarity on the investigative side, the epidemiological investigations, how that team kind of handles outbreak and situations such as this. So initially what they're looking for really in these situations, when we start seeing cases in a facility, the first thing the team is looking for to links to other cases around town and try to find that common location. And that's what happened in this scenario. There was, through the investigations of multiple cases, they're able to find that it was through one common location, and that's what led to the clarification and declaring it an outbreak. What they do is eliminate any coincidences with other contacts possibly in the public, and then they'll try to reach back around to really hone down to one location. That's what happened in this case. And really right now the goal is to identify new cases and isolate those new cases so the spread does stop eventually within that facility, and again ultimately with the community spread as well. Just a real quick update, like Caitlin had mentioned before, today we have 5 new cases, brings our case total up to 32. Based on investigations, we've labeled 9 of those as suspected community transmission. None of the new cases today, however, were actually labeled community transmission. We've had a total of now 6 recovered. So our count, we have 26 active cases as of 2:30 p.m. today. One last thing I want to touch on, there are some questions regarding how you get established or labels recovered. So there's a few factors that have to be met in order to be considered recovered from this illness. One is it must be a minimum of 7 days after initial symptom onset. Also, you have to be 72 hours without a fever, and that is without any kind of medications, any fever-reducing medications. And then finally, you've got to be symptom-free. So when you meet all three of those criteria, then you fall into the category we mentioned before is recovered, and those 6 individuals at this point are completely recovered from this. That's really all I had today. I guess I'll open it for questions right now, if there's any questions from the media.
David, I wonder if we could just start just looking back at those numbers.
Mm-hmm.
So of the 32 total cases that we've had, can you tell us how many were at one point in the hospital and how many are currently in the hospital, if that makes sense?
Looking at those, I don't know if I had those hospitalized right now. Sorry, I'm looking at the breakdown
Okay.
that the EPI team had given me. I don't have those current numbers, but I think, Caitlin, I don't know if we may work on something to see if we can get that
Okay.
publicized social media.
And at this point, do we still just have one patient who's in critical condition?
That's my understanding. That's
Okay.
correct.
Okay, great. And then do we know of those 32 cases, how many are healthcare workers or worked in a healthcare facility?
Yes, 13 of those are going to be due to healthcare exposure.
Okay.
Yes.
And are all those 13, well, I guess 12 from post-acute medical and 1 from Driscoll's, or?
Sorry, to clarify, I hadn't been
Sorry.
repeating the question. No, I hadn't been repeating the question. The question was asked as far as the healthcare exposures, how many were attributed to that? I don't have the breakdown exactly, but not all of them are attributed to Pam North. So any kind of exposure in a healthcare facility, we're gonna group that into that section right now, and that's 13.
Okay, got it. Dr. McNeil, you had mentioned the supply chain issues for testing. Don't have enough swabs, don't have enough reagents, everything? Is there something specifically that we're missing?
The question was concerning the testing and what specifically do we not have. Okay, well, to do these tests, of course, we do a nasal swab. Getting the nasal swabs is pretty easy. Those are just little sticks with cotton on the end of them, so we can get that. But there's a specific substance called VTM, or viral transport medium. Did I say that right, David? Yeah. Well, the viral transport medium, and that's what's lacking right now. We have to have specific things to transport these collection, but they're coming up with new ways of doing this. And I can tell you too, we're working very hard on a rapid test, and we're hopeful to get a rapid testing ability in our area soon. When that happens, that'll be a 15-minute test. Abbott has come out with it, and it is being distributed across the United States as we speak. It's just going to the areas like New York, Washington, and California that need it more than we do.
And are you aware how many, if we have any of the Abbott machines that can run that rapid test currently, or if we would need to get the machine as well as the test? If I'm understanding correctly.
It is a specific machine, and it is being sent out. I wish I had one, but I wish I had a bunch of them, to be honest with you. But you know what? We may have one in a few weeks, or a couple of weeks. So I've told everybody, as far as this testing, the beauty of that is like when we take a healthcare worker. So we have a healthcare worker that has had an exposure, and they've been around for 3 or 4 days. They really haven't had any symptoms, but they've still had a primary exposure, so that limits what they can do. They can either work with a mask in some cases, but sometimes they can't work for 14 days. So, or if we have a patient, are they going to spread it to their family? If we had a way of knowing in 15 minutes whether it was a yes or no, if it was yes, well, then they get isolated, and we watch them for development of worsening symptoms. If it's negative, they go back to work, or they go back to their lives without having to worry about having this disease. That's a amazing thing, and it's coming. We just didn't have it because we've never had COVID-19 before. But the private sector has jumped on this, and it's coming. It's coming very soon.
What are the demographics of the 5 new cases?
Sure, I've got those. So the question was as far as the demographics of the 5 new cases. We've got a total of 4 females in those, 1 male. We've got 2 females in their 50s, a female in her 20s, 1 in her 60s, and then we've got 1 male under the age of 18.
And what are the demographics of the 6 who have recovered?
I do not have those in front of me. So the question was the demographics of the 6 are recovered. I don't have that information.
I have a couple of questions from the viewers. One is, why have none of the disclosed locations that patients have visited in grocery stores? Are they being excluded for some reason, or they just haven't been visited?
So the question as far as the locations at, I guess the low-risk exposure locations that we discussed in some of the press releases, why haven't some of the grocery stores been in there? What we look at is the level exposure. Like we had, during the investigative process, there's different levels of exposures based on obviously the type of exposure, the length of exposure, how close you were to individuals in that facility. Those immediate high-risk contacts are directly contacted by the epi team, and then most of the medium risk as well. And that leads us to the low-risk side, where we can't really identify, such as the one we had done previously with the Sprint store, Lone Max, and Toyota, and a couple other places, to where we couldn't say, okay, for sure we can say you were with this individual this amount of time or another one. So we have to put a blanket statement out to address locations, maybe days or times of certain days. We haven't identified any other larger stores or, any grocery store, any, large, big box store yet to be any kind of exposure level. That's not to say there hadn't been a case possibly in those stores, but during the investigative process, we wouldn't label that as any kind of low-risk exposure. But anybody be exposed in those facilities.
And the other one was, Dr. McNeil, I guess that would be for you. Do the post-acute medical staff at the north location also work at the south location, and vice versa? If yes, will they expand testing to that facility as well?
That has all been done through the epidemiological team, and it's something we looked at very closely because certainly some workers from one facility may go to the other. And if they're infected, then of course they could infect that other facility. So we immediately stopped that, and we worked with post-acute. We identified those patients, and that was all part of our urgency in the very beginning. It's part of the reason that's what we were doing yesterday. So that has all been done. We're also testing patients from those other facilities. We're monitoring those patients from other facilities. If we start to see anything over there, then we'll get on that facility just like this one and work with them to get it straightened out. They've been very cooperative, and we've been very careful about that. But that's an excellent question as far as watching the potential spread to another facility. We worry about that with every facility. We worry about those patients going to our other hospitals. We worry about everything. So that is all part of the thing that we're looking at.
Dr. McNeil, I just wanted to clarify for testing for healthcare workers, is the current kind of protocol for individual facilities or operating standard, I guess, that a healthcare worker will receive a test when an exposure is identified? And do we have any capacity to do daily testing for healthcare workers who are treating COVID patients? I know that's something's done in higher volume areas with more cases.
Well, if the one thing that you have to understand is that just because you were exposed that day doesn't mean that you're going to test positive that day. So there is an incubation period where it takes enough for the virus to replicate to where you can actually be tested. It's got to replicate, and it's got to be present in your nasopharyngeal passageways and so airways. So that's where we test. But to answer your question, we do prioritize those healthcare workers, because if you think of a patient in a room, that's a patient that's isolated. If you think of a healthcare worker, they may be, if you have a nurse that may have 6 patients, that nurse is going to 6 different rooms. So we are very careful about that, and we do aggressively test them, and they all know to monitor their own symptoms. And of course we encourage them, or we tell them not to come to work sick, and we're even screening every person that comes into the hospitals and into healthcare into facilities. They're screened if they have any symptoms and if they have fever.
Okay. And then I did want to briefly ask you, for the drugs that we're researching right now to see if they're effective for COVID-19, are those generally prescription drugs?
They are prescription drugs, and to be honest with you, I don't want people to think that they can call their physician and just get this medication, because it's actually, for lack of a better term, not FDA approved. So there are some physicians that are taking it, but they're physicians and they know the risks and benefits of doing this. And these are people that have high risk exposure, and these are people that are around this every day. And so everything in medicine is a risk and a benefit. And if the benefit exceeds the risk, then you can do it. The benefit probably does not exceed the risk for the general public at this time, and that's what the FDA is looking at. That may change tomorrow, but I'm just talking about what the current.
I'm just curious if we know a patient census for Pam North. I believe they have 26 beds, and are they all staying put for the time being?
We've been very careful about that, because it really wouldn't do any good to have a facility that we know that COVID is in and then start sending those patients to other hospitals. So we've been very careful about that, and for the most part, they're those patients are staying there, but they're all being tested, and they're getting good care there. I mean, they're being monitored and they're being cared for.
And do we have any estimation for when the masks will be, the gift will be delivered, the gift of masks will be getting here?
I don't know. We had actually, we're still talking with that, and I think they were getting our address last time I checked, so that's a good sign.
And then I don't know if we ever got the demographic information for yesterday's 7 cases. How many were there?
There were 7 yesterday, yeah, and I just had the demographics for today,
For
but
today, okay.
yeah, I'll be happy to get that for you
Okay.
offline, yeah.
Okay, great.
Any other questions right now? Okay. If not, I'd like to thank everybody for their time and tuning in today. Just a reminder that for accurate information, if it's released on the Victoria County Public Health Department Facebook page or on our website, victoriatxoem.org, it's accurate Victoria area information directly from your local officials. For any COVID-19 related questions in Victoria County, you can call our hotline 361-580-5796, and that runs Monday through Friday from 8 to noon and 1 to 5. This will be aired tonight on our Suddenlink channel, that's channel 15 or 115 at 6 p.m. tonight. And we got word today that Fox 19 will also replay this briefing at 10:35 p.m. Again, that's Fox 19 at 10:35 p.m. Following the closing of today's briefing, a recording will also be aired on KIX, Q92, Jack FM, and Club radio stations. If there's anyone in our community with unmet needs, we urge you to call 211. And the Texas Health and Human Services has launched a 24/7 statewide mental health support line, and that number is 833-986-1919. Just a reminder that we had 5 new cases of COVID-19 today for a total of 32 in the area. And we will update website and social media with those numbers and the demographics, along with the Q&As that were answered earlier with our legal and law enforcement for the Stay Home, Stay Safe order. Over the weekend, we will continue our operations. However, we will not have any daily briefings unless there's breaking information. However, we will continue posting to the website and social media with daily counts and any relevant information that comes out. Thank you all for your time, and we'll see you Monday at 3 p.m.